Hello, my name is Pamela Mourine. I'm a Teach for Kenya Cohort 4 Fellow at Kivandini School. When I joined Kivandini School, I realized that most of my learners, especially the boys, were shying away from conversations around menstrual health and sexual reproductive health. To them, they felt like this was girls' affairs and they didn't see any need for them to be included in such talks. Girls, on the other hand, were excluding themselves because of the stigma that existed around menstrual health and sexual reproductive health. This was a challenge for a long time, and when I offered a baseline survey to the teachers, some of the community members, I decided to come up with the JASO Inclusive Health initiative. JASO Inclusive Health, as the name suggests, includes both boys and girls. What we do basically is offering comprehensive education for both boys and girls on matters on menstrual health and sexual reproductive health. We are also working on a handbook, which will be like a long-term solution whereby the learners will be able to easily access information on menstrual health and sexual reproductive health. This project also creates a space for the learners to speak about so many things around menstrual health and sexual reproductive health, and apart from that, they are able to also talk about other things that affect them, that limit them from accessing quality education. I also got an opportunity to go for a reusable sanitary towel production workshop whereby I was trained on how to make the reusable sanitary towel. This skill I've been able to extend it to the learners and also the community at large.
I'm Lydia Lamka from Kivandini Primary School, a member of Menstrual Education Club. In this club, we have been learning through the help of our teacher Pamela. We have learned about reusable sanitary towels. Also, we have learned about hygienic practices to take during the cycle.
The success of this project is as a result of the support that we are receiving from the school administration, including the head of institution and the system teachers and the community who really believes in whatever we do, and they're really looking forward to seeing their learners being sustained in school. This project has impacted 129 learners, and 73 of them have been directly impacted through receiving the sanitary products. I have seen most of my learners, especially the boys who are shying away from having these discussions, getting involved in discussions around menstrual health and sexual reproductive health. I can also see the girls staying in school during their periods, reducing absenteeism in classes. This is one of the wins that I'm enjoying. The introduction of Let Girl Thrive project in our school has also greatly impacted our work at JASO Inclusive Health initiative, which is promoting gender equity. JASO Inclusive Health initiative is creating a space for learners to speak freely and also breaking the biases that still exist on gender-related issues. This project is also bringing up learners who will be leaders that can address issues in the society without shying away from them. I'm really grateful for this opportunity to create change in this community through our learners. I've come to learn that change doesn't happen within a day, and that I really have to be patient with my learners, embrace them, create that space for them to express themselves freely. This is what JASO Inclusive Health initiative aims at.